All right. Hello again, everybody. Hopefully you've made it back from your break. We're going to go ahead and move forward with our getting ready for our next session. I did want to announce a change that you may or may not have noticed in our agenda that we shared as part of that introductory slideshow. So we had planned for this session to be a panel of representatives from a few of Wisconsin's qualified health plans. And we've done this for many years, for most years actually of this conference. However, while it seems like most years of that HealthCare.gov has been around, have been very dynamic, with new and changing policies being introduced every year and things being, again, dynamic. This might be the most uncertain yet, as we talked a little bit about in the first session. And acknowledging this environment, it became clear as we approached this conference date that what we had originally envisioned just wasn't quite feasible at this point, so when so much remains in flux and undetermined as of yet. And a lot remains unresolved for the QHPs, the qualified health plans. So this posed a challenge whereby not all the information for their open enrollment plans and rates were finalized or possible to share publicly and with confidence. As such, in order to continue our goal of providing enrollment assisters with the most up-to-date information, we've instead asked Jenny Sullivan of the National Center for Budget and Policy Priorities to present a session titled HealthCare.gov Policy Deep Dive, Premium Tax Credits. So instead of having our QHP panel, of which we most really appreciate having that, this year it didn't make sense and weren't quite ready for that, honestly. So this session will provide a higher level overview of what consumers may be more likely to face when looking at the marketplace, including what things are set and what things are not yet set, even at this date. I really want to give a big thanks to the qualified health plans that had been willing to engage on this panel this year. So that's Health Partners, Common Ground Healthcare Cooperative, and Network Health. We really look forward to inviting them back next year and having them be a part of this panel, and apologize for the change, but we also know that this information is going to be really quite valuable for you. And so with that, I'm going to hand it over to, actually, no, I'm not going to hand it over just yet. I'm going to introduce our session speaker. So Jenny Sullivan. So Jenny is the Director of Health Coverage Access and leads the Center for Beyond the Basics project, which provides training and resources about the Affordable Care Act's marketplace and health coverage programs to support navigators and others who help people get and keep their health coverage. She joined the center in 2018 and has led projects related to housing and health integration, as well as population health and state fiscal policy. Previously, she was the Director of Policy and Programs at the Alliance for Health Policy and also served in leadership roles at Enroll America and held positions at the Centers for Medicare and Medicaid Services and Families USA. She holds a Master of Health Science and Policy from the Johns Hopkins Bloomberg School of Public Health and a BA in Sociology from Kalamazoo College. So yes, I want to thank Jenny very much for being here and really appreciate her willingness to help us make sense of this moment and to really see what's in store for consumers as they take a look at health coverage plans on the marketplace. And so with that, I will hand it over to Jenny.
Great. Thanks so much, Allison. And thanks to you and your colleagues for having me back. It's always a huge pleasure to be with this group, even in this very uncertain year. Hang on one moment. I'm going to share my screen so you can see my slides. Let's see. Let's get this one. Okay. Hang on one second. Let me get my screens all organized here, and then we'll be good to go. Okay. All right. So, and I guess this means I can advance my own slides, which I need to be ready to do as well. Okay, so as Allison mentioned, I have been doing enrollment related work for many years now. In fact, since the very beginning of HealthCare.gov, my 11-year-old son just started middle school, and he was born 3 days after HealthCare.gov launched in 2013. I always love to work him into my open enrollment presentations, but this is a year unlike the many previous ones we have seen. So we have a lot to talk about. And you're going to get to hear from me twice this week. Today, I'm going to be talking about premiums and sort of the premium landscape going into 2026. And on Wednesday, I'll talk more in depth about some of the policy changes that we are seeing come down the pike as a result of the new marketplace regulation and the reconciliation mega bill that has big implications for the marketplace. And then there have been some lawsuits in the interim that have made things even more interesting to track. So I will give you the latest, greatest. There may even be some updates on those lawsuits between now and then. But today we're going to talk about premiums. Let's see if I can get my screens. Okay. So, although I can't speak on behalf of Marketplace QHPs in Wisconsin, I am going to try to get us all grounded in the current state of play and what people are likely to experience this year. And I'm going to start with a review of the basics, and then we'll talk more specifically about premiums for 2026. Now, I know most of you have been doing this work for years, so a review of the basics might not sound like what you need in this moment, but stay with me. I've shared a similar presentation with a few other audiences lately, and in this moment when so much is changing, it can be grounding to revisit some of these fundamentals as we sort of layer on the many things that are about to change. Okay, so the marketplace landscape. The marketplace is at a major inflection point right now. We've got more than 22 million people, including more than 294,000 people in Wisconsin who currently rely on the marketplace for their health insurance. And if you're looking at the slide and you see 24.2 million, that was the number of plan selections for 2025 coverage. 22 million is where we're at now in terms of effectuated enrollment. We know not everybody pays their premiums or needs coverage for the full year, but what did the latest snapshot look like? In the middle of 2025, we still had 22 million people and 294,000 people enrolled in marketplace coverage in Wisconsin. We've seen tremendous enrollment growth and coverage gains in the past 4 years, and this has been due in large part to the premium tax credit enhancements that took effect in 2021. They have made coverage vastly more affordable for millions of people, and that includes a lot of very low-income people, people with income between 100% and 138% of the federal poverty level in states that have not expanded Medicaid. So a group that didn't have a coverage option before, but because of these enhancements can get coverage without having to pay a monthly premium. Just been a tremendous benefit for those individuals. So in addition to the premium tax credit making zero premium coverage available to people with income up to 150% of the federal poverty level, it also makes premium tax credits available to people with income over 4 times the federal poverty level if their coverage would cost more than 8.5% of their income. So wide across the board, the enhancements have helped everybody that is getting coverage in the marketplace right now. But as you probably know, these enhancements are due to expire at the end of December this year. So we sit on the precipice of major change in the marketplace. The future of the premium tax credits is on the line, but there are also a whole host of other policy changes from a recent Trump administration marketplace regulation and the reconciliation mega bill that the Congressional Budget Office estimates will cause millions of people to lose marketplace coverage. And you can see here, we've got about 3 million people who would lose marketplace coverage because of the changes in the law and the regulation, plus an additional 4.2 million people who would lose coverage if the premium tax credit enhancements expire. People who remain enrolled and decide they can still afford coverage in some way, shape, or form they may choose to downgrade to a less expensive plan. So maybe they're in a silver plan now and they can't afford silver plan premiums anymore. So they choose a bronze plan, for example. Or of course, the 4.2 million is the people who may look at these increases and say, I cannot afford this, or I could afford a bronze plan, but it's not going to meet my needs. So I'm going to choose not to stay covered. People in every state will be affected by these changes, and there aren't a lot of opportunities for state flexibility or different ways of implementing these. That there are some, but not a lot, the way you might see, for example, if there was a federal Medicaid policy change. Obviously, there's a lot of talk about work requirements right now and how those might roll out in different states. The marketplace changes are more top down. There are fewer opportunities for states to make big changes in how they're implemented. All these changes are coming at us really quickly. Obviously, we're only a couple months out from the start of open enrollment. And in fact, some of the changes in the marketplace regulation took effect a few weeks ago on August 25th. So there is a lot changing, and every day the landscape is a little different than the day before. So, although I am going to assume that most of you have a pretty deep understanding of the premium tax credit and how it's calculated, I'm going to go over it again today because it's important to make sense of the rate changes that we're seeing this year and what they mean for enrollees. So when a person enrolls in a marketplace plan with a premium tax credit, as 89% of people in Wisconsin do, people who are enrolled in marketplace coverage in Wisconsin do, the federal government pays the premium tax credit amount directly to the marketplace health plan that the person chooses, and then that reduces the balance of the premium that the person then has to pay out of their own pocket. People with lower incomes get a larger proportion of their premium paid for. We have this number, this expected premium contribution, which is a percentage of the person's annual household income. So this amount is then subtracted from the premium for the benchmark plan where the person lives, and that is the second lowest cost silver plan in the rating area where the person lives. And then that remainder, the benchmark minus the expected premium contribution, that dollar amount that's left is the size of the premium tax credit. But the person can then carry that tax credit and apply that dollar amount to any plan available to them on the marketplace, and then they pay the balance of premiums. So for people who were getting an enhanced premium tax credit that covered the whole premium for the benchmark plan, if they like the benchmark plan, then they could stay in that plan for $0 premiums. So they don't pay anything every month. They might pay cost sharing. They will most likely pay cost sharing when they're getting services. They're not paying a premium every month to keep their coverage. And that's true also if somebody takes that premium tax credit amount and can pay the full premium for a different silver plan or for a bronze plan, for example. You might also, just to clarify all the different alphabet soup we have, you might also sometimes hear the acronym APTC. That stands for Advanced Premium Tax Credit. People can take the credit in advance to lower their monthly premiums, or they can pay for their full premium out of pocket, and then the following year, when they file their taxes, they can get their credit as part of their tax refund. Now, obviously, most people take at least a portion of the credit in advance because that's what makes their coverage more affordable for them. But if you hear the word APTC, don't confuse that with EPTC. And what I try to do when I talk about the premium tax credit enhancements is what I just did, to talk about them as a PTC enhancement. It's not a separate PTC. You've got a PTC and then an EPTC, or some people get EPTCs and some people get PTCs. No, there is one premium tax credit, and we have just amped them up for everybody who is getting them in the marketplace ever since 2021. So these enhancements work by reducing that expected contribution amount for everybody. So with the premium tax credit enhancements, of course, we've got, as I mentioned, the people that can get a benchmark plan for 0 premium, people over 400% who can get a plan or who can get a tax credit to cover a portion of their premium if their benchmark plan would cost more than 8.5% of their income. So at the end of the year, these enhancements are due to expire. They were initially enacted as part of pandemic relief, but they were subsequently extended 3 years ago, and we are just at the end of that 3-year period right now. If the enhancements expire, The premium tax credit itself will still exist. I do also hear sometimes some fast and loose language about PTCs expiring. And that gives me some heartburn because I worry about enrollees hearing that and getting the wrong impression that all of their financial assistance is on the line. And while it's the impact, it could make coverage less affordable or unaffordable for lots of people, there will still be financial assistance available even if the enhancements expire. But it will be dramatically smaller, and enrollees' net premiums will increase by more than 75% on average. So you think the 20%, 18% premium increases sound bad, 75% if the enhancements were to expire. And that varies a lot by where you live and how old you are and how your household is comprised. But it's a very big deal, suffice it to say. So the thing that has been all over the news lately, as marketplace issuers have filed their rates or their premiums for 2026, is that gross premiums are going up. They're going way up. And in their rate justifications for 2026, insurers have pointed to things like increasing healthcare costs, increasing prescription drug costs, the impact of tariffs, uncertainty around the premium tax credit enhancements, and in some cases, issuers pointed to changes in the marketplace regulation as a reason that they are increasing their rates. They're also expecting a riskier case mix. So what does that mean? So marketplaces pool risk, so insurers pool risk. When everybody pays their premiums, the insurance company pulls those premiums together and is paying for coverage and for services that the people need, but a lot of people don't need a lot of services. And so the premiums get spread across the population. If it is harder to enroll because there is more red tape, which again, we'll talk more in depth about on Wednesday. If premiums go up and some people run for the hills and decide the marketplace is not affordable for them, there are fewer people enrolled. Statistically speaking, the fewer people who will stay enrolled are the people who know I have prescription drugs I need next week and I'm not about to let go of my coverage, or I have a service or a surgery coming up this year, or I'm in the middle of treatment for a chronic condition or cancer. And I know that this is not the moment I can let go of my coverage. Those people are going to find a way to stay covered. They're going to figure out the finances, many of them. The folks who are expecting a relatively healthy year, don't really think that they have a lot that they'll need in the coming year, are the ones that are more likely to say, I'm going to take a pass. This is just too expensive for what I think it's going to be worth to me. Insurers look at that and are predicting for this next year that the people who are going to stay covered in the marketplace are going to be riskier. They're going to have higher healthcare needs, and that's going to require a higher premium amount from those folks who remain enrolled so that the insurer can pay all the bills. Again, I don't mean to be patronizing because I know this is stuff that a lot of you understand really well, but just to kind of lay the groundwork for the circumstances that we're seeing this year. Now, people who don't get a PTC, so people with income over 400% of the federal poverty level who would no longer get a PTC at all, they are going to feel every dollar of these increases that insurers are asking for. But the majority of enrollees, again, 89% in Wisconsin, get a premium tax credit, which helps to insulate them from the brunt of these increases. Talk a little bit more in a moment about what that means when you mix together increasing gross premiums with a decreasing premium tax credit. So just a note that the figures here are based on 2025 premiums. We don't have the final 2026 premiums yet, and we will be updating our analysis when we do. But we looked for this at 2025 premiums with the enhancement and without. And you can see these are all three of these cases are people just over 400% who are going to lose premium tax, or like their premium tax credit. You can see that they're going to have an enormous increase in their premiums. And this is not, again, not taking into account the 18% plus increase in premiums that we're starting to hear we should expect for 2026. So we will be updating this, but right now that just gives you a little bit of a ballpark. And then similarly, I just wanted you to know that we have a map. If you want to zero in more closely on a smaller geographic area, you can click on this map. It's congressional district, but doesn't need to be used for any sort of lobbying or advocacy purposes. You can also just look at it for informational purposes. And you can look at specific areas of the state and see how average premiums would increase. And we'll be updating this as well once we have the final 2026 amounts. Okay, so with that, I think it is time for our first polling question. So true or false, without congressional action before the end of the year, the enhanced premium tax credits will end December 31st, 2025. True or false?
Yeah, and we'll give that maybe just another 20 seconds as people consider. And then we can pop up the answer. We can probably go ahead and show the answer.
Okay. Very good. So most of you got that right. Those enhancements are due to expire at the end of this year. Congress has got a lot on its plate, as it always does, and it's possible that this could get considered as part of the continuing resolution to keep the government open that Congress will have to make some decisions on before the end of September, or they could run out the clock even more, and we could see something in October or November or even December, which could cause a whole lot of chaos for enrollees. But it is something that we will know more about in the coming months. Okay. Okay. So, now that we've revisited how the premium tax credit is calculated, and I hope you didn't fall asleep during any of that. I know it's a lot of math for early in the morning, but let's talk about 2026 premiums and what all these things mean for enrollees. So we know that gross premiums are going up significantly for 2026, but the PTC is structured to shield people from these increases. But that shield, if you're a visual person, the shield that is the premium tax credit will get significantly smaller if the enhancements expire. And we may also see plans that are less generous in 2026. There were regulation changes that allowed issuers to offer plans with higher cost sharing requirements in 2026 relative to the metal tier that they are offered in. The fate of that particular provision rests with the courts right now, but it's a possibility. Regardless, people are looking at much higher premiums next year, which is going to force people to make some difficult decisions. Can they still afford their current plan? Do they need to switch to a plan with a lower premium? Can they afford any plan available to them on the marketplace? And if so, is it even worth it? Does it cover their preferred doctors and their prescription drugs? Does it offer enough pre-deductible coverage to be worth the cost of the premium? These are conversations it's a preview of conversations that you are likely to be having in the coming months. So gross premiums are up. They're going to be much higher in 2026. And that, of course, is the total amount that the issuer charges, not taking the premium tax credits into account. And the weighted average is actually, we've been talking about 18%, but the weighted average is more than 20%. You can look up insurers' justifications. They have to say when they file their rates, this is why we're increasing, and this is why we think this percentage is reasonable this year. And you can look that up for plans that are available on the marketplace. I looked at a sampling of plans from Wisconsin, and it's similar to national trends. They're saying that it's increases in the cost of healthcare, prescription drugs, increased utilization, and the threat of enhanced premium tax credits expiring. And they expect, again, a sicker case mix in 2026 as healthier folks decide it's not worth their time this year. So, anyway, let me move on. But gross premiums, that gross amount that insurers are requiring for enrollees, is definitely up. But this year, these increases could come alongside expiring premium tax credit enhancements, which will saddle marketplace enrollees with truly unheard of premium increases. So I know that the print is probably small, even in the version of this that you're looking at, but let me walk you through these bar graphs. what you can see here is an example of a family of four with an income of $85,000. And in the top bar, in 2025, they're paying just over $4,000 for the whole year for their premiums. The premium tax credit covers the rest of their premium. That's the kind of the light, the light yellow bar as well as the stripes. The stripes show you what proportion of their premium tax credit is from the enhancement. Now in 2026, if we apply that average 18% gross premium increase to their premium, you can see that with the enhancements in the middle bar, they're actually paying a little bit less, about $3,800 for the year. Because again, if we assume their income hasn't changed, the amount that they're required to pay for a benchmark plan is the same. So the premium tax credit expands to take on that additional gross premium. But you can see that a lot of that expansion happens with that enhancement. The enhancement helps with that a lot. If you look at the bottom bar, without the premium tax credit enhancements, their premium payments nearly double to more than $7,500 for the year. Obviously, a huge, huge increase. And so that's what I mean when I say the premium tax credit really insulates people from gross premium increases in most years. But right now, by coupling huge gross premium increases with a shrinking of the premium tax credit, consumers are left holding the bag. So many, many people will choose to drop to a lower cost plan or to leave the market altogether. And I want to say that although people may react to these announcements about premium increases and I'm foreshadowing conversations that you may have with enrollees, they may be frustrated, they may lay blame with insurers, with corporate greed. It's really important, I think, for people to understand that, and for you all to understand, which I'm sure you do, that there is a policy solution for this. Is this the perfect world where premiums can go up a whole lot every year? Maybe not, but there's a policy solution that has protected people from these increases historically. And what is happening right now is that those protections are being peeled away and exposing people to more of the increase at a time when obviously people's costs for any number of other things are going up tremendously. So this is not a problem without a solution. It's just that we need the solution to be extended. So, okay, so when will enrollees be notified of their premiums? You might be wondering, when are people going to actually know, what is my specific premium? I've heard all this news, I'm a little worried. What do I know? How can I find out about what I'm going to actually be charged next year? And like so many things, the answer is complicated. Usually in a typical year, people would get notices in the fall from their marketplace, so from HealthCare.gov in Wisconsin, and from their specific marketplace health insurance company. And those notices would provide information about the person's estimated premium tax credit amount and their estimated premium for the coming year. And then obviously we always encourage people, go back to the marketplace, update all your information, you'll get a much more precise estimate of what your premium tax credit will be for the year. This year, the Centers for Medicare and Medicaid Services has granted insurers flexibility not to include premium tax credit and specific premium information on the notices. Because, as Allison mentioned before, as we think about even insurers coming to panels like this or presentations like this, there is just so much uncertainty. There's things changing by the hour with court decisions and things changing in Congress. And so issuers have some flexibility there because they don't want to send out notices that are inaccurate and mislead people, but it's really hard to provide accurate information right now. That means that people might not get information about what they're going to be charged until the window shopping period opens. And that's, a few weeks before open enrollment starts, when you can go onto the C plans tool on HealthCare.gov and enter in information about a sort of basics about your household to get information. People are going to be really scared, I think, when they do this in many cases. If this is the first time that they're seeing, oh my word, what is going on with my premium? Why did my premium tax credit go down? And more to the point, why is my premium up? So how this all plays out is really going to depend on if and when Congress acts. Congress could act in September, and we could have a situation where by the time window shopping starts, people get an accurate picture of what their assistance and their premium is going to be for next year. Congress may not act in September or even October. And in that case, when people go to the window shopping tool, they will see a premium tax credit that assumes the enhancements have gone away. So they're going to see a huge premium jump. Now, that doesn't necessarily mean that is what they're going to pay next year, because there's a few more months in the year, and Congress is good at making 11th hour decisions. And so we could see the clock run out or get very close to running out before we know more about the final disposition of the enhancements. But this is a tricky thing, because if people come in, they see a number in, either during window shopping in late October or after open enrollment has started in November, and they say, I cannot afford that. Or I really like my plan, but I can't afford that, so I'm going to go with this bronze plan because it's all I can afford right now. Congress could still act later, and those folks, how are we going to let them know? How are they going to know that they could actually come back? The open enrollment period doesn't end until January 15th, and so people do have a little bit of time after the end of this year if something were to happen that changes the enhancements. And so I'm going to get a little drink here. We do need to be thinking about how we are communicating that to people who are getting assistance right now, and how we let them know that they may have an opportunity to come back at the first part of next year to revisit their options and get something that's a better fit, both for their budget and for what their healthcare needs are for the year. So it's tricky. And I think the other thing that I want to mention is automatic re-enrollment. Now, I actually was looking up for the presentation today, and although on average more than half of marketplace enrollees re-enroll through automatic re-enrollments, it's lower in Wisconsin. You only have about 38% of enrollees in 2025 who were automatically re-enrolled from 2024. But nevertheless, these are folks who didn't necessarily come back to the marketplace. They said, it's working fine for me, set it and forget it. I'm just going to keep paying my premium and my coverage will continue. And those folks could get some massive sticker shock if they don't act and don't come back and look at their options, make some decisions by December 15th. They're going to get automatically re-enrolled in something that could have vastly higher premiums, and they may not find out until they get their first invoice for their January coverage. And that January coverage invoice is likely to come at some point in December when things are busy, people miss mail, there's a lot going on in the end of the year. And if people get that notice, then they have a couple weeks, they can make some adjustments so that if it's not what they want, they can cancel that coverage for January, pick something else to start February 1st. But that's a small window of time at a very busy time of year. So we have a lot of dynamics and a lot of kind of high stakes decisions that people are going to need to be empowered to make at the end of the year and very beginning of next year. Okay, one more thing here. Catastrophic plans. So HHS made an announcement late last week that it is relaxing some of the criteria for enrolling in a catastrophic plan to make affordable coverage available to more people. So let's just talk for a moment about catastrophic plans. They are part of the ACA, they're part of the marketplace. They are not off marketplace plans. They're not short-term limited duration, none of that. They are a marketplace plan, but they're only available to a small select group of folks. So they're actually available on and off the marketplace. They have relatively low premiums, but very high out-of-pocket costs. The deductible for a catastrophic plan is equal to the out-of-pocket max for the year. So for this year, it was at $9,200. And so they have a very high deductible, and they cover very few benefits before that deductible. They cover preventive services and typically like 1 to 3 office visits. That's it. Any other healthcare services, you are paying full cost for those until you reach that very, very high deductible. They do cover essential health benefits because, again, these are marketplace plans, but they are not a solution that works for a lot of people. So who can get a catastrophic plan? These are available to people under age 30, to young people, people whose premiums would exceed a certain proportion of their income, people with a marketplace granted hardship exemption. And that's what HHS changed as of last week. They are widening the exemption to include people who are newly ineligible for premium tax credits or cost sharing reductions. And they've sort of changed some of the processes to fast track the hardship approval process. So catastrophic plans are an option. They are not a high value solution for people with known healthcare needs. People who hear about them, and again, if you're having conversations, you're doing outreach, people who hear about them should know that they should absolutely request a full determination of eligibility for their premium tax credit before they request a hardship exemption to enroll in a catastrophic plan. We don't know exactly how the sort of decision architecture will work, and we want people to request that full determination, whether they're working with an agent or broker, another assister on their own, because we don't want as people to forego a premium tax credit in favor of a catastrophic plan that is going to provide less coverage, and it's still going to cost a lot. These plans are not free. In Wisconsin, I took a look at a few plans available in Madison, and the premium range was between $174 a month and $229 a month. And again, that comes with a $9,200 deductible this year. It'll go up next year. And there's no services covered pre-deductible other than 3 office visits, and those each have a $30 copay. So these are an option. They are potentially an option that we may see HealthCare.gov pushing more. We may see some agents or brokers who are offering plans off the marketplace entice people towards, and they're fine, but they are not the solution for everybody. So please proceed with caution when it comes to catastrophic plans. Okay, navigator cuts. I know this is not news to anyone here, but you can't tell the marketplace landscape story for this year without mentioning these major cuts to navigator funding. Federal navigator funding was cut by 90% in every state that uses the federal marketplace. And so in addition to tough choices about premiums and affordability, I alluded to the fact that people may also face other new red tape barriers for 2026. Again, we'll talk more Wednesday. And so people are going to need more help than ever navigating both the process and understanding their options. But unfortunately, there will be fewer people available to provide that help. And we know that, including in Wisconsin, navigator programs have been creative and have been smart and looked at different ways to bring in funding because these programs are so critical and people absolutely rely on them to navigate these processes, particularly in a high stakes year like this. But just know that it's a tough year and different programs are making different choices about, for example, how it can help people with Medicaid if the marketplace is really only going to measure success by marketplace enrollments. Just one example, but an important thing to note that is going on this year. Okay, so this is all a lot, and we haven't even gotten into the regulation and the reconciliation bill yet, but here are some of the things that you can do. You can let partners, let people know that a lot is changing and that they should stay vigilant and engage through the process. If the marketplace sends you something in the mail, read it, pay attention to it. If they email you and say you've got a notice in your inbox, figure out how to log in, even though sometimes that's hard and not something people do throughout the year. And so what's my password? Help them figure out how to stay in tune with what information the marketplace is providing. I didn't even put this on the slide, but one thing to be aware of is that the marketplace is doing some more vigilant work to identify people who might be dually enrolled or that data sources suggest are dually enrolled in the marketplace and in Medicaid. And if that's the case, they are sending these through the marketplace, sending people notices that give them just 30 days to true up where they belong, whether they are truly eligible for marketplace or the Medicaid. And if they don't act, their marketplace coverage ends. That's it, that's all. And so paying attention to those notices and staying really on top of them is going to be critical this year. Things that actual enrollees can do. update their information, make sure the marketplace has this is kind of some of the things that we talked about a few years ago for Medicaid unwinding, but make sure the marketplace has the up-to-date information and how to reach you. Mailing address, email, phone number, etc. You don't want to get caught with a communication snafu that means you don't have all the information you need to make choices in time. Encourage people to actively renew and compare their options for 2026. Don't rely on automatic re-enrollment. Read notices, requests, respond to requests for information by the deadline. And again, assisters are going to be really helpful for people to figure out what they need to do to meet those verification requests by the deadline. Update your marketplace account throughout the year if the person's income changes, and make sure they know that they can come back and get help doing that throughout the year. It's going to be really important. Again, we'll talk more Wednesday, but it's going to be really important because repayment caps are going away. So if people receive more premium tax credit than they're eligible for, they're going to have to repay all of the amount that they got that was over their the amount that they were truly eligible for, and they won't be protected by caps anymore. Stay up to date with premium payments and get help if payments become affordable. This is tied up in a lawsuit right now, but there is the potential for insurers to require people to pay all past due premiums before they can have coverage effectuated for a new year. So you don't want somebody running a premium debt this year that could jeopardize their coverage in the future. And then finally, always reconcile your advanced premium tax credits during the relevant tax season. So this year we'll be doing this for 2026, we'll be doing them for the 2025 credits. Again, tied up in some of the lawsuits, but there is the potential that the marketplace could return to a 1-year failure to reconcile barrier, which means that if people forgot to reconcile their tax credits, forgot to file their taxes, they could be locked out of the marketplace and from getting premium tax credits the following year. And then finally, it is sad that I have to say this in this moment, but and there are eligibility changes that are happening along with all of these other barriers. So there are people who will just literally not be eligible for coverage anymore anyway, but please update those lists of who the community providers are where you live, because there are going to be a lot more people who don't have health insurance and who still have healthcare needs. And you're going to need to be able to provide them with a list of where they can go and be served on a sliding scale. Okay, and then I won't read through all of this, but just in case it's useful for partner purposes, for social media purposes, this is the same information couched in a slightly different way, just sort of an enrollee-centric way. I have a question about this. Here's a potential solution. Okay. And so that actually takes us to our second polling question. Who can qualify for a catastrophic plan on HealthCare.gov? People under 30, people for whom premiums for a marketplace plan exceed a certain percentage of their income, people certified by the marketplace to have a hardship related to their ability to enroll in a marketplace plan, or D, all of the above.
Yeah, and we'll give people just a few more seconds to consider this question. Especially in light of everything that Jenny just shared. And then once we're done with this, we can get to some of the Q&A that people have been adding. Please do continue to add some of those questions there, and we'll talk through a lot of what Jenny has shared.
Okay. Very good. Looks like the majority, once again, were listening, paying attention, or you knew a lot coming into this, because you're correct. All three of those circumstances would qualify somebody for a catastrophic plan. Okay, so that is the end of the slides and the prepared remarks, but we can go to Q&A, and I can probably turn off my slides. I'll just say I assume that these will be made available to people later, and there are some links to different data tools and resources to the extent that people are interested in those. So
wonderful.
Know those are heading at the end.
And I know that we did, as usual, have a question, just if those slides will be shared. Yes, the slides will be shared after the session. So you are welcome to, and they will be on our website. So as will the recording of this session, in case that's helpful for people. I know that we have several questions in the chat. One, as we were just talking about, and had the poll question about the catastrophic plans. One is, did CMS define hardship as it relates to eligibility for catastrophic plans? And I'm not sure if you covered that specifically or if we know much about that quite yet.
So there have always been the sort of hardship exemption, and there are various criteria under that. I will be honest, I have not ever paid a lot of attention to this because it just marketplace plans that are not catastrophic or provide such a richer benefits package. But there were already criteria, and what this change as of last week does is widen those by saying that people who are newly ineligible for PTC or for CSR, cost sharing reductions, would qualify for a catastrophic plan. But we can also, I can send some links to the deeper stuff if you want to get into the weeds on that.
Yeah, thank you. Yeah, I mean, this policy, the expansion of the catastrophic plan eligibility was just released last week. Was it Thursday or Wednesday?
Yeah, it all blends together.
Yeah. So I think one question that I had was just knowing that not all of the carriers in Wisconsin currently, or at least historically, have included catastrophic plans. At this point, with so much happening, and I know that there's still a few opportunities for plans to finalize what they're going to be offering, yet at least in Wisconsin. Are plans allowed to add catastrophic plans with this new understanding, or is it like, nope, that's too late? Or is that out of your understanding of just maybe what's allowable in Wisconsin?
So typically we would be too late to be adding plans. But the reason I hedge a little bit is because there are things going on with the lawsuit, and in addition with the enhanced premium tax credits, that we may see some flexibilities this year that we've never seen before in terms of issuers refiling rates or making adjustments to things. So maybe, but it remains to be seen.
Yeah, I know that there's, you mentioned lawsuit. We won't get into the weeds of what those are and everything, but my understanding is that it opens up a little bit of like, okay, are there still moments where carriers could modify their plans before it's final? Do we have any sense? I know I saw one reference to just a change about actuarial value. That could mean that plans might need to modify or even remove some plans they had been, the carriers had been anticipating they would offer. Do you think, in addition to just the pricing issues that consumers may face this year, there might just be overall fewer options that a carrier has? Or again, is it just really unclear? We just don't know yet.
I mean, at a very surface level, we've seen a small number, not a huge number, but a small number of issuers decide to exit the marketplace. And that was, I mean, they're reading the tea leaves and trying to make, the decisions that make sense for their business, but it wasn't necessarily a reaction directly to all of the things going on that we've talked about this morning. The actuarial value example is interesting because the regulation that I mentioned was finalized at the end of June. So issuers had that information as they were preparing and finalizing their rates for 2026, and that we're moving through the rate review process. The lawsuit that I mentioned, the actuarial value provision is one of 7 provisions that the judge ordered an injunction on. So those are stayed right now. But the administration then, about a week ago, submitted an appeal that the only provision that they asked for relief on was the actuarial value provision, their argument being issuers have already filed rates and they've already got things set up, and so it would be so disruptive to not implement this. We haven't heard from the judge yet. That was supposed to happen either Friday or today. Maybe it's happened since I logged on this morning, but it is just a very dynamic time. And again, I think we're just going to see things that we've never seen before.
Yeah, for sure. All right. There's another question in here, just about silver loading. The question is silver loading still allowed, or was there a policy update precluding that? If it is, can you give a brief explanation for people? If not, then let's just leave it there. And I know you touched on it a little bit, but.
So it was a live thing that was being negotiated and talked about during the debate around the reconciliation bill earlier this summer. should we get rid of silver loading, which would mean that, again, the person said don't get into it if it doesn't apply, and it doesn't, but I'll just say silver loading is shorthand for getting money to issuers because they provide the cost sharing reductions, but Congress is no longer funding them directly. They still have to provide them, and so they wouldn't want to provide something that they're not getting paid for. But the way of paying for them, the sort of payment route, has been to increase their silver level plans such that the money they're getting for the premium tax credit helps offset what they're paying out the door for cost sharing reductions. There's been talk this year about, well, Congress should fund the cost sharing reductions and then we'll get rid of silver loading. But going back to my math slide earlier, if you reduce the second lowest cost silver plan across the board, then you're actually shrinking the premium tax credit amount as well. And certain people would see movement in terms of their premiums because of that. It wouldn't be as widespread. There's sort of a more precise impact on different income groups if that were to happen. But the long and short of it is that did not happen. However, we do not think we have heard the last of that interest in getting rid of silver loading, directly funding cost sharing reductions. So stay tuned.
Yeah, I think the big, and this is probably true every year. There's just so many little, as some people like to call them, levers, right? Just little tweaks here and there to kind of keep adjusting and seeing if the right mix of all those things coming together gets the government, gets plans, and hopefully consumers what they're looking for. But yeah, it's a complex mix. Let's see, let me look at some of these other. There was a question here. Can you please, and I know you touched on this a little bit, but it sounds like maybe wanting to revisit it a little bit. Can you please speak to the new PTC, APTC repayment limit rules?
Sure. So historically, ever since the PTCs have existed, there have been caps that say you don't have to, based on income, there are limits to how much the government is going to ask you to repay of any overpayment amount that you might have received. And something that the reconciliation law did, I was saying bill before, but it's a law. Something that the reconciliation law did is remove those payment caps and say, if you have an overpayment of premium tax credits, advanced premium tax credits, then you have to pay it back, all of it. All of the overpayment you owe back to the government down to the penny, with two exceptions. And we will actually talk a little bit more about this on Wednesday as well. But people whose income drops below 100% of the poverty level, or in Medicaid expansion states, not Wisconsin, but people whose income drops below 138% of the federal poverty level, do not have to repay. And those are provisions that are in the regulations. They are way down in the nitty-gritty weeds, but we have resurfaced them and have them at our fingertips now because people are definitely curious about that. So suffice it to say, people always do the best job they can predicting the future, which is of course impossible to do with 100% accuracy. But when people project their income, if things change, or actually the other thing that we always say is, make sure you write down, make sure the person comes out of the appointment and understands what went into building their projected income for the year, so that you know what assumptions you made, because it's really easy to forget that. And come April, May, you get a different job, your hours change a lot. It's hard to remember what you did during open enrollment, but if you have that, then you can bring that to an assister or use that yourself and adjust your income in the marketplace. But we always say also talk with an assister, because it's not always as simple as just adjusting your income, because it depends on how much premium tax credit you've already received that year compared to your new projected endpoint, because you may have received a lot of most of what you were due in the first few months of the year, and you don't want to just adjust prospectively, because then you could still have a repayment amount. And if you didn't follow anything I just said, then just know that people should update their income throughout the year and work with an assister to make sure that they're calibrating the advance payments as closely as they can to avoid having to repay.
Yeah, no, those are really good tips for sure. Yes, it's especially in a moment where you know, open enrollment happens when there's a couple holidays, it's busy, it's a lot going on, and it's a stressful moment. So for sure, documenting, writing down, and that's a great tip for, you know, working with sisters who are working with consumers. Just write it down, in that way, you know, hopefully the consumer can then reflect upon, like, oh, did any of these pieces change, these assumptions that I made? For sure. Let's see. There's a question in here. There's some good questions in here. I will share them with you, and you can of course let me know if you're like, yeah, this starts to get a little bit beyond scope, at least for today, or just what we're able to address. Here's a question. So current consumers who have a marketplace, and they're lawfully present immigrants and are currently receiving APTC, they call on Navigator and ask if they're eligible for APTC for 2026. How do we answer this question?
Okay, so at a very high level, there are three big changes that are affecting eligibility for marketplace coverage for people who are immigrants. One has already gone into effect. People who have DACA or have DACA status are no longer eligible for marketplace coverage. And the marketplace has already started notifying these people, and their coverage ends at the end of September. And that's full stop. They can't get coverage without a premium tax credit for a full cost either. They are not allowed to have coverage through the marketplace going forward. The second change goes into effect next year, but for the 2026 plan year, and that affects people who get a premium tax credit who have income below 100% of the federal poverty level, but by virtue of being in the 5-year bar or otherwise not being eligible for Medicaid based on their status, but who are legally present, they can get premium tax credits right now, but that eligibility is going away for 2026. The last tranche of changes for people who are immigrants take effect the following year for the 2027 plan year, and that is a radical reduction in the people who are eligible for premium tax credits, and it shrinks that population down to people who are citizens, people who are legal permanent residents, people who are entrants from Cuba and Haiti, so Haitian and Cuban entrants, and people who are migrants from the COFA territories. If somebody does not fit in one of those buckets, then whatever other immigration status they have, they are not eligible to receive premium tax credits. They can still enroll in marketplace coverage, but it would be full cost. So,
yeah. And did you say that last group that starts when?
January 2027 for the 2027 plan year.
Okay, so not the current open enrollment that we're about to go into,
Correct.
but right. Okay. Let's see. I'll ask maybe one more kind of premium tax credit question, and then maybe a broader question just about the thing you touched on about Navigator programs and just what those are facing this year. The question is, if a consumer is under 138% of the federal poverty level, do they qualify for a tax credit?
Yes. If they're in a state that has not expanded Medicaid, if they are not eligible, let's put it this way, if they are not eligible for Medicaid, then they do qualify for a premium tax credit as long as their income is over 100% of the federal poverty level. Does that answer yeah?
I think so. So we're just about time here. So like I said, I'm curious. So you had a slide that talks about, you know, that reviewed just the federal funding cut for Navigator programs that started just as of late August of this year. And I mentioned that early this morning as I was welcoming everybody, just to give a little bit of landscape for covering Wisconsin, being a Navigator agency for the state. From your perspective, and just to kind of help give context of what this is looking like, even outside of Wisconsin, what is your what are Navigator entities broadly? How are they responding? What is this looking like overall?
Yeah, thanks. I mean, it's a tough conversation. It's a tough time. Any program that has to take a 90% cut has to radically change what it is capable of doing, and its scope. And what we have seen in other states that are affected is programs say developing new systems to triage anybody that needs assistance related to Medicaid to the Medicaid agency or other parts of the state architecture that can serve those individuals, but essentially closing their door, which is heartbreaking because we know so many people live in households where some people are in the marketplace, some people are in Medicaid or CHIP, and the programmatic distinctions don't make a lot of sense to people outside of this very niche space of enrollment and eligibility policy. We've also certainly seen, I mean, virtually all programs have had to lay off staff, have had to radically reduce the number of subcontract partners they're working with, so they're not able to provide as much coverage across the state and statewide. We've seen some partners lean into using hotlines and contracting with organizations that provide help via phone so that they can still have some capacity to reach people in places where they don't have physical staff or partners, but they want to still be able to help people. Trying to think if there's anything else. Those are kind of the broad brush strokes, but it is a little bleak right now because again, it's sort of akin to the premium tax credit. We have gross premiums going up and premium tax credit assistance going down. At this moment, we have complications and red tape going up and assistance to cope with that going down. And unfortunately, enrollees, consumers are the ones that are going to experience the brunt of this. And it's really sad.
Well, thank you so much for your time today and just really pivoting with us as, this is a moment to moment, hour to hour, sometimes dynamic environment. Really appreciate your broader overview of just what the landscape is looking like. Even though we weren't able to share kind of more specific details from plans, it's just the situation we're in. And I think this was fantastic. So thank you so much. I will also mention that given, talking about the catastrophic plans and some of the other coverage options that consumers may be considering, we will have a session, I believe tomorrow, where we'll dig into that a little bit more, especially with some perspectives from OCI about just what are some of those coverage options that consumers may be considering so that assisters can just be aware of them and aware of pros and cons and just maybe how to give some education of what they're expecting and what they're observing. So with that, I will thank you, Jenny, and we will see you again on Wednesday. And we release you for today, so thank you. And we are going to do a 10-minute break, and we will be back here at 11 to do our final session of the day. Thank you all.